I'm very honoured to be asked by Lymphoma Australia to give some feedback on what's happening in CLL at ASH. And in fact, Australian investigators have been pretty prominent here. John Seymour from Melbourne, he presented the update of the Marginal trial. So very impressive trial in relapsed CLL where patients were randomised to either venetoclax combined with obinutuzumab or bendamustine rituximab. And that trial has now got 4 years of follow-up. It's got very impressive data, impressive overall survival. 85% of patients alive at 4 years, which for a relapsed refractory CLL trial is very impressive. They've done a lot of deep dive into the depth of remission, these so-called undetectable MRD, minimal residual disease, and have been able to map out how these patients have done over time, because that's one of the aspects of venetoclax that we find so interesting, that venetoclax can drive these very deep remissions, and without sounding too obvious, the deeper the remission, the more likely it is to last for a longer period. So very interesting data from John. But John's not alone. Contam, another big Australian name, presented a set of interesting data. I guess his Beijing data with the new drug zanubrutinib was most impressive. Difficult patients, 17p deleted cohort. Again, very well tolerated. These new drugs are quite striking when you compare them to the old days with immunochemotherapy. And there's a message for your patients out there. The world has really changed. Zanubrutinib, ibrutinib, acalabrutinib, all these new BTK inhibitors, and of course venetoclax as well. Outpatient tablets, well tolerated, good side effect profile, and good responses and durable remissions. So Con's data was very convincing, and that's a drug, well, we've had a bit of experience in the UK in the trial setting as well, but Australia has definitely led the way a bit there. And then what else is new from ASH? Well, we've had other upfront trials. We had the Elevate trial, which is an acalabrutinib trial with or without obinutuzumab compared against chlorambucil compared with obinutuzumab. Great data, well tolerated, met its primary endpoint, clearly keeps patients in remission longer, and just actually nudging towards a survival advantage, which was a bit of a surprise for all of us. Well, I was a co-author on the paper, so I'd seen it coming, but it was certainly a bit of a sit up and look at that. So not quite as many prospective phase 3 trials this year at ASH as last year, but certainly very exciting for the CLL community.